the Chief Human Resources Officer here at Lower Umpqua.
I'm Bobby. I'm the lead medical assistant at Dunes Family Medical.
Hi, I'm Rochelle Batchelder, Clinic Operations Manager for Dunes Family Health and Reedsport Medical Center.
So Lower Umpqua Hospital is a critical access hospital that's located on the Oregon coast. We're about 5 minutes from the ocean, so we're in a really beautiful area. Reedsport is generally more of a retirement town. We have about 4,000 people that live here, many retirees. We've got a golf course and a lot of other fun things to do here in the area. And our patient population that we serve in our district is about 8,000. So even though there's only 4,000 that live right here, our patient population served is about 8,000. So we have a beautiful community to the north, which is Florence, Oregon, about 30 minutes away. And we have the Coos Bay North Bend area, which is about 30 minutes to the south. And we have employees that live in both of those areas and some that live right here in Reedsport. But it's a great community, and the community loves our hospital and our clinics. Very important that we are an independent hospital, and we plan on keeping it that way. And I think that our clinics have a really good reputation in town. We have, it's important to us to hire quality providers, quality staff, quality leadership, to keep that momentum going here in the community.
So we have here in the district, we have two different clinics. We have a family practice clinic, Dunes Family Health, and we also have a surgeon specialty clinic, Reedsport Medical Center. And here at our family practice facility, we have 4 full-time primary care physicians. We have 2 MDs and 2 NPs right now on the team. We also have a same-day clinic here at Dunes Family Health, and we have currently, we have 4 providers who rotate through our same-day clinic, and that's 3 MDs and 1 NP. And then down at our surgeon specialty clinic, we have 2 general surgeons. We have an ortho surgeon. We have a women's health surgeon. And then we also have a pain specialist who comes in twice a month. So that's kind of an overview of what we have for our services here in the clinics. Here in our clinics, we use Meditech as our EMR, and then patients have access to their medical information. They're able to correspond with their team via the portal inside of Meditech. So that's really nice that we can communicate with our patients through the portal. They don't always have to call, because sometimes the phones can get tied up and be difficult. So that's kind of a nice feature that we have.
Currently, nurse practitioners see 14 patients a day. They do have an hour blocked at the end of the day for to complete their charts. And there are 2 spots throughout their day that are blocked for same-day visits also.
Some of the primary healthcare needs that we have here in Reedsport is mental health. We have a lot of need for mental health services here in the community, as well as substance use disorder. It's kind of the typical needs of any healthcare facility right now, but that's probably our primary need right now, is those services, having them available.
I think one of the great things about this position is just the camaraderie over at the clinic right now. I think that you have great support by the team that's over there. So each provider has their own MA. And I think that we have one of our doctors has been there for several years. He's a great resource, very kind, very collaborative, and very supportive of staff coming in. I just think that the day-to-day operation is set up to where someone can have a nice work-life balance. It's 4 days a week. We're not asking you to see 25 patients a day and just be this big workhorse. I mean, there are expectations, like Bobby had talked about. It's 14 for an NP is the target average, for a day, but it's giving you time to come to work, see your patients, do your charting, and then also have a life outside of the clinic. And I think that's very important to most people these days, to have that work-life balance.
One of the great things about the district here is being in a clinic that's small and rural. Our providers really have this great collaboration relationship with their colleagues. And they also have that balance in the clinic where they're not, seeing so many patients that they don't have time to collaborate with other providers here in the clinic. So the collaboration amongst our providers here is really exceptional. I've worked in large organizations before where you don't see this kind of collaboration. So I think that's something that is a huge benefit for any provider, is to be able to have those collaboration and relationships with their colleagues.
I just wanted to comment about the beautification that's been going on over at the clinic in the last couple of years. They have taken out carpeting and replaced it with beautiful flooring. And right now they're actually doing another little renovation over there, just kind of changing a few other things around. There's been new furniture that's been purchased. The waiting room is beautiful. It's been repainted, and Marshall and the team kind of had an idea to put up our mission statement. And so that's up on the wall now. It's kind of clear and concise, but it just looks really beautiful in there. And I think everyone working there just kind of takes pride in that whole area and how nice it looks and welcoming for the patients. And then we have this really great opportunity in the back part of the facility. We have a couple of picnic tables that we purchased this last year that kind of took a while to get here, but they're here now. And they have this really neat outdoor area where the staff can eat outside, and it's kind of this little beautiful area just among the trees right outside the back porch. So as the weather gets nicer, it will be a better used area back there. And I think there's some beautification planned for that area. And then maybe a dedication for one of our former employees that may be happening back there too, to add to that as well.